Alright guys, happy Monday. Just woke up and I gotta be a little quiet because my kids are still asleep. Yeah, I usually wake up at like 7 in the morning, get ready, do my skincare routine without waking up the kids before I take them to the bus stop. So let's jump into it. I don't usually make my bed, but I'll try today. I think this is pretty good. Alright, moving on to the bathroom. So in my closet, I got my scrubs all ready to go for the day. I'm gonna choose my blue scrubs today, just for the Roche-Posay. And good job yesterday, Seahawks, for a big win against the Niners. Let's get ready. So I have to shave this morning. What I like to do is wash my face with a gentle cleanser. This is the Purifying Foaming Cleanser by La Roche-Posay. It has a nice foaming action that will help prep my skin. I use warm water to foam this up on my face, and then I'll shave. So this is like a 2-in-1, right? You get to cleanse your face while also having a nice foam for the shaving part. Because I just had laser done recently, you can see all the marks there. I had laser done 5 days ago. I'm not gonna do my vitamin C serum. I'm gonna actually jump right into the Cicaplast. And I got the bigger size of the Cicaplast here to put on my face after I shave to help repair the skin, help repair the skin barrier, and soothe my skin. After that, I'm gonna apply a sunscreen, and typically I will put like La Roche-Posay's Tolerian Double Repair UV. This is a facial moisturizer with SPF 30, has niacinamide, ceramide, but because I'm worried about hyperpigmentation from visible light, not just UVA causing hyperpigmentation, but also visible light outside, I wanna wear a tinted sunscreen. So that's what I'm gonna do today.
I love how a little goes a long way. This bottle lasts forever.
Use warm water. Then rinse with cool water. Just make sure that you always use a clean towel. This is a single-use towel here. Oh, I think the kids are getting up. The Cicaplast here. No, this is not comedogenic if you just put a small amount. This is great to put on right after you shave. Very soothing for those marks that I just got lasered. There you go. Then I'm gonna apply my tinted sunscreen. All right, Dr. SPF is all ready to go. Tinted sunscreen on, get the kids at the bus stop, and go to clinic. Gotta have my espresso every day. I put creatine in my water because I work out. It helps with recovery and muscle mass building. I like to eat eggs in the morning for protein. Today I'm actually gonna eat breakfast burrito. Lots of protein here.
And ice cream.
Cheers. Running to the bus. We're late today. All right, bye. See you later. Have a good day.
Bye, honey. Have a good
and
day.
my wife, she's actually a doctor and she does it all. So thank you for what you do. Love you. Bye.
Love you. Bye.
All right, on my way to clinic. It's about 20 minutes to get to clinic from my home, and I like to listen to audiobooks. I'll listen to some YouTube videos on coaching. I've coached flag football and basketball at the moment. And you guys know I wear sunscreen in the car because you can get UVA through the side window. So wear your sunscreen in the car even. It's gonna be a good day today. My schedule, I have 2 surgeries today. That's removing skin cancers, and we're going to be seeing acne, rosacea, psoriasis, atopic dermatitis, and do a ton of skin checks, like a dozen skin checks. Yes.
So this is our beautiful waiting area. No patients here yet. And I'm gonna walk back into the office.
Got my white coat. And of course, my trusty handy Derm light. Have to use this for every patient visit, whether it's a rash or skin check. Looking for basal cell carcinomas, squamous cell carcinomas, and then most importantly, melanomas. This helps me diagnose them. And by looking at certain dermoscopic features, it's gonna help me decide whether to biopsy or just monitor that particular growth or lesion. All right, we got my medical assistant here. Let's do this. And yes, of course, we need our liquid nitrogen before we go into each room. This is great for pre-skin cancers, seborrheic keratoses, skin tags, warts, and more. And we're getting Dick's for lunch today. This is a Seattle classic, fairly affordable. Good shakes as well. All right, flow of clinic is going so well. I'm actually gonna go into a surgery now, an excision. So I'm gonna do a squamous cell carcinoma excision. Squamous cell carcinoma is very common, but also pretty aggressive. More aggressive than the more common skin cancer tumor called basal cell carcinoma. We're gonna be doing this excision on the leg. I take a good size margin, I go down to the subcutaneous fat, and I'll put 2 layers of stitches in, and then we'll see the patient back in 1 to 2 weeks to get the stitches out, the top layer stitches. The bottom layer will dissolve on its own. You wear your sunscreen, guys, go for SPF 30 and above, and reapply every 2 hours. But if you're getting sweaty, if you're working out outside, make sure you're using a water-resistant sunscreen, and also reapply every 40 to 80 minutes. For example, here, because I'm working on hyperpigmentation after that laser 5 days ago, you know, go for a tinted sunscreen with iron oxides. Look at the ingredient list in the back, look for iron oxides. This one is water resistant 40 minutes. So if I'm working out or if I'm jumping in the pool, I should be reapplying this every 40 minutes, okay? And this is SPF 50, so this one would work well if I were to go for a run outside and I wanna protect face from worsening hyperpigmentation. Okay, so I'll see you guys after the surgery. Seattle classic.
For the late night.
Dermatologist, we talk about diet and acne. As much as the milkshake was tempting, cow's milk and high glycemic index foods really can flare acne. And so milkshakes, sorry guys, but that's a big double hitter that can really cause inflammation in the skin. I will indulge in a burger every once in a while. And that hit the spot. So we're gonna do afternoon clinic next, and let's get into it.
Let me show you real quick our exam room. So make sure no one's in here, right? It's empty. This is a nice spacious room where I do my surgical excisions. And for max efficiency, we have a biopsy tray all set up for the provider, ready to go when we have to do a biopsy on a suspicious lesion. And next up, we have a pulse dye laser here. It's great for red spots on the face. It targets hemoglobin, so it works on broken blood vessels or telangiectasias and redness from rosacea. Stepping over here, we have some steroid and saline for deep cystic acne. We got our formalin biopsy bottles because we do biopsies, send off to the lab to diagnose skin cancer definitively with the dermatopathologist. Walking on over down the hall, just love our office. Very nice and welcoming for the patients, great lighting, great for skin checks and also filming social media content. This is my cryo gun, which shoots out liquid nitrogen. And I bring this into every appointment. Like we said before, it's so versatile. Works on a range of different skin growths. Just got out of a patient's room, an acne patient, and we gave her topical medications, oral medications, and she's just doing so well. Her face is just clear, glowing. The blemishes from her previous acne that was very inflammatory and even cystic, those blemishes are fading well with the retinoid, a topical retinoid. And so she was just so happy. And I said, wow, I mean, you're glowing. She says, well, this is all you. And when she said that, it just reminded me of why I got into dermatology. It's not just for cosmetics and injecting neuromodulators or fillers or doing lasers. This is truly because I want to have great relationships with patients and being a big part of their transformation. Having healthier skin is what we want to strive for. And, for a young female, this is huge for her, for her going through college or having, getting ready for a wedding. Taking part in patients' lives in that way, in a positive way, is so great. And I love the continuity of care with my patients. When we talk about relationships, it's about staying with them in their journey to get healthier skin. And it's, versus my wife, she has a very important job. She's a hospitalist. And so she's in the hospital and admits patients who are very sick and takes care of them for a week at a time. Then she takes a week off before she goes back onto a whole different panel of patients. For me, it's patients I've been seeing for the last 8 years here in Seattle. I see their kids, I see their grandkids, I see their spouses. I'm very grateful for the trust that they give me to take care of their family, which is a huge compliment to myself. But I love that connection. I like seeing their family holiday cards during this time of year. So it's a really big part of my day, seeing patients who are happy. I produce content for the world, but I also love being here in clinic, seeing patients on a daily basis. So I won't let this go. Let's do a sample closet tour. I love my sample closet. Look at all this La Roche-Posay here. Great samples for traveling, and just gonna fix those tilted boxes there. Actually, this moisturizing body and face wash is great. I put the samples in this paper bag and send patients off with samples, and I'll tailor the samples to their skin type. So as you can see here, the Tolerian Purifying Foaming Cleanser is good for combination to oily skin, while the Tolerian Hydrating Cleanser is great for dry skin. Now in the evenings, I recommend for those with clogged pores, the Effaclar Medicated Gel Cleanser with 2% salicylic acid goes into the pore and cleans out those pores. Again, my favorite versatile skincare product at home that's essential, Cicaplast Balm B5. And the best over-the-counter acne medication you can get is La Roche-Posay's Effaclar Adapalene 0.1% gel. Sunscreen. So great to give sunscreen samples to my patients for reapplication every 1 to 2 hours. Go with a sunscreen SPF 30 and above. And yeah, these samples are so handy for reapplication because you can keep in your pocket.
So just finished clinic and did a chemical peel, had a few more acne visits than I expected, but overall a very nice day. Hope you enjoyed being in clinic with me today. I'm gonna go off and hang out with the kids and practice some basketball, and I'll show you my nighttime routine soon.
Actually, my evening is quite chaotic. I have to scarf down dinner really quickly because I have to go to the gym, work out, lift some weights, do some cardio, but also go to my son's basketball practice and help coach basketball. So I am very busy with these activities after clinic, but it keeps me active. I feel healthier. It's a great way to relieve stress. And do you know that resistance training twice a week can increase collagen production? So helps with fine lines and wrinkles. So that's definitely a bonus motivator when working out with my personal trainer twice a week. When I get home, I go straight to the shower. I have to wash my face and my body. I like to use the Effaclar Salicylic Acid Cleanser for my face and body to prevent acne.
When your skin is dry, apply a pea-sized amount of retinol. Just a pea size, okay? And you don't want to put it onto damp skin because that will increase your risk of skin irritation. So a large pea-sized amount is about that size. Break it up. Entire face, do not spot treat.
And because there's different lasers, always check with your doctor on when to restart your retinol.
So my skin's now starting to feel back to normal, so I'm gonna reintroduce the retinoid now. I'm not gonna do it when my skin's feeling tender, inflamed from the laser procedure. I think now is a nice time to apply it. And when I apply it, I feel no sting at all. If you like a serum instead of a cream, I like La Roche-Posay's Retinol B3. That one's nice, has niacinamide, which is a nice brightening ingredient that helps regulate sebum production and it's anti-inflammatory. Plus you got your retinol to increase collagen production and reduce those fine lines and wrinkles. Then follow up with your favorite moisturizer. I'm gonna put some Cicaplast on now. Yes, you can put Cicaplast over your retinol. So let's go ahead and just put, not a ton, just a nice film. Might put a little bit more for my retinol. Okay, and then if you want to put a little bit of petroleum jelly, if you want to put a little petrolatum ointment on your lips before going to bed, especially when the heater's on during the winter time, go right ahead so you don't wake up with dry chapped lips. And if you have dry cracked heels, go ahead and put some petrolatum on the bottom of your feet and put a sock over it, and you'll wake up, take the sock off, and it's gonna be nice and smooth. So thank you guys for hanging out with me today. It's been great showing you my day. Grateful to be able to fit it all in, seeing patients, being a dad, coaching, and spending time with family and patients and my wonderful staff. So hope you guys stay well, and thanks for tuning in. Peace.